I know you guys see a lot of Dr. Cliff Olson on this channel, but just know that back at the office, he's actually the only guy. Take a peek at this clip of a ladies-only discussion with all of the other providers at Applied Hearing Solutions.
Be able to understand exactly what it is we're trying to, accomplish with this, hearing aid fitting.
Okay, so we can measure, we can verify, we can put things up on the screen, we can show someone why we need to do something that we've recommended. But you said something earlier with the other case of, in the very beginning, you said we talk through all these things and we're trying to figure out what are your goals, what are your values, what are your needs, what things are important to you. And oftentimes if someone isn't necessarily ultra tech savvy, they may not report Bluetooth as being something that's wildly important to them. But I think that something that we do at our practice is, I mean, we walk people through, and in the initial consultation portion, God, we are just drilling our patients again and again. What is most important to you? Tell me every situation. If you say friends and family, where your friends and family?
Who specifically?
Who? Exactly. If you tell me restaurants are trouble, well, are you going to restaurants with one person or are you going with your whole family? And is that a female speaker or is that a male speaker? We drill and drill and drill and drill because we need to be able to make a treatment recommendation that's going to meet all of your needs and your deepest needs, not just these surface level needs, but your deepest needs. And so I could see how it'd be really, really tricky in your case as more of a patient-sided limitation and an equipment limitation of going, I didn't even know that this was something that's important to you, and you didn't even know that this is something that was important to you until you got it. It changed your life, and now you're like, crap, it's not working well. Fix it. Several individuals that have come in that go, I'm not having a problem. I'm just here to get so-and-so off my back.
Yeah, Dr. Olson and I were talking just yesterday about, somebody who comes into the office who says, well, I'm here because my partner doesn't think that I can hear them, but their partner's not with them. So we don't really have both sides of the story.
No, you just have the one. And they say, oh, they only talk to me from 7 rooms away. And that's the only reason I can't hear them. And you're like,
but if there's no pain point that we're solving for, why are we both here? You know, so because
and you'll ask that.
Oh yeah, and if there's nothing to solve for, then we can't do our job. So we really do need that companion in that case there with the patient in order to understand what are we solving for, because you can't solve a problem if you don't know what the problem is. Those situations where they come without their spouse, which is the main reason why they're there. So
oh man. I think too, a lot of times, and this is definitely true of most people when they first get started in audiology, right? You're putting so much weight and so much emphasis on the audiogram itself. You look at the loss and you go, what do I need to make this work? And you're looking at it less from the perspective of the human that's in front of you, and more so of, this is the hearing loss that's in front of me, this is what I need to fix, and this is the equipment that I need to do that. But so often you get in this groove, you're like, okay, I have this and this and this, and I have everything, and this should be perfect for you. And you set them up with it, and it's not working for them. And you're going in circles, and you're like, okay, we'll switch to this manufacturer, or we'll switch to this style. You miss it, you miss it, you miss it. They're still unsatisfied, still dissatisfied. And you're going, what am I missing here? And what you're missing is them.
Exactly.
The person.
Yeah, that's so true.
And it's like taking everything that you know from a textbook or a grad school perspective, and then throwing all of that over to the side. You're going to use that baseline knowledge, but being able to look at someone and go, this is why it's not working for you.
Definitely.
Your need. It requires digging like crazy at the front.